Good morning, good afternoon, good evening. Thanks so much for investing the time to let us tell you a little bit about what Freespira is, what we do, and how our evidence-based approach is helping patients all across America deal with the symptoms of PTSD and panic disorder. My name is Justin Sanders. I'm the Director of Client Success here. I've also got with me today Dr. Bob Cuyler. He's our Chief Clinical Officer. Today, we're going to share what it is that Freespira does to make an impact in patients' lives every single day.
I'm going to give you a quick tour of the published studies that look at treatment with the Freespira system for panic disorder. This slide shows 3 independent studies of patients with panic disorder. The elevation on the left-hand side shows patients who were starting off with a panic disorder severity scale, which is really kind of the go-to instrument for measuring panic symptoms, with average scores of around 15. Well, what does that mean? It means that somebody is having frequent and severe panic symptoms. They are afraid of when the next attack may occur, and they are altering their life in order to avoid triggering situations. We have some patients who will not drive on the freeway, who will not leave home without someone accompanying them, who are afraid of maybe being called on in class because they associate these triggering events with the onset of panic. And so they begin to avoid, and then in many ways really kind of cripple their life function because of these avoidance behaviors. In the middle, we see these same patients 28 days later. I will mention across these studies, the average duration of disorder was greater than 10 years, which means that these studies are enrolling patients with chronic conditions. And what we see in this middle are patients who have gone from a moderately severe to severe symptom load to a remission or near remission level in only 28 days. And on the right-hand side, we see follow-up with these same subjects out to a full year post-treatment. And what we see is a maintenance of this benefit without return of symptoms out to a full year without any access intervention. So it's notable that patients are learning how to reform and normalize their breathing, and they are retaining those skills and using them. And this developed self-management skill is helping them maintain without return of these symptoms. And it's really kind of a strikingly stable pattern for 3 independent studies. In our next slide, we're showing results from a study that was done at the Palo Alto VA for treatment of PTSD. This was a study, interestingly, that was open to both veterans and civilians. The average duration of condition was 19 years. So again, this is a patient pool in this study with a chronic condition. 6 months post-treatment, without any access to this intervention after the 28-day period, almost 90% hit one marker of clinical success, and that is a 6-point or greater reduction in the clinician-administered PTSD scale, the CAPS. Over 80% had a greater than 13% reduction in the same metric, and 50% were rated by the investigators in this study as no longer meeting diagnostic criteria for a diagnosis of PTSD. This is striking to me, to take a population of people with a 19-year history of this condition and to take half of the study population to the remission level. The 77% adherence rate means that 77% of the recommended 56 sessions were done in the 28 days by the study enrollees. That's a very strong adherence rate for use-at-home therapy, which is really strikingly above what's reported in most of the literature about technology-delivered mental health interventions.
So thank you for investing the time. Thank you for everything that you do to treat your patients. And most importantly, thank you for trusting us with your patients. My name's Justin Sanders. I've got Dr. Bob Cuyler with me. You can reach out to me at justin@freespira.com, or feel free to give me a call at 904-566-5371. Thanks again, and be well.